The Gibraltar Mental Welfare Society is going to mark World Mental Health Day on Wednesday. They've organised a public talk which will feature Vicky Ward and Mark Montovio, who's here in the studio to tell us a little bit about it. Good afternoon, Mark. So an important day to sort of really talk about mental health, and you're choosing to focus on holistic care planning.
Yeah, it's an important day worldwide, and I think it's crucial that we continue to mark it, commemorate it. Although this year the theme is interventions, in crisis and emergencies, we felt that it was much more important to look at how we might prevent from so less and less of these emergencies and crises, happening if we look at everything holistically, and if we do holistic assessments and look at what the person needs to avoid, entering a crisis.
So what is a holistic model of care?
If we look at the person as a whole, is made out of different aspects. We have a physical body, we have a mental health. We have all sorts of things related to what is basic needs, food, all that. But we also, as social beings, we need to have access to leisure. We need to have access to to training, education, even friendships. And I think that is crucial, because a lot of people with mental health issues are in a bad state, and when they get worse, those are the areas that suffer. And then
they
things
need that
progress.
support network, don't
yes,
they?
Yeah.
Mark, tell us a little bit about the sort of main focuses of the talks. What are you hoping to cover?
What we're hoping to cover really is that we want to really make it, the important point that yes, we need psychologists, yes, we need psychiatrists and counsellors, but often when the person has healed, enough, and sometimes things are chronic, they can deteriorate because the other aspects are not dealt with. So we want to bring it home. We want to bring that idea home, that an assessment that involves a holistic care plan is really central. So how does that person access leisure? They might need support to access leisure. So, we can say, oh yeah, the leisure centre is there. They can go and have a coffee. But if they don't have the support, and if they have anxiety, social anxiety, or if their self-esteem is very low, their mental health might be stable, but they won't be able to access that. So it does mean that increasingly they stay at home, they do less, they are more in their thoughts, and things get worse. And then we have a crisis.
So World Mental Health Day, important to talk about mental well-being openly. Have we seen progress at the society level when it comes to understanding mental health issues and awareness of them?
Yeah, I think we have come a long way. One of the big stumbling blocks, we're not talking just about treatment and access to community services, I think is stigma. I think that is crucial now, and we've been doing a lot of work on that. Public Health will be talking about that, I think, on Friday. We're launching an anti-stigma campaign, and we're working very, very closely together because that is crucial. Very recently we had, a message on social media saying, there was a patient with mental health issues in the ward. How horrible. I actually think the comment is pretty horrible. Because, where else should they be? I mean, when they are ill, that is where they should be. Maybe they need more support.
Is it something like saying, I can't believe that there was somebody at A&E with a broken ankle?
It's a little bit like that, that is the access. Someone is ill, that is the access. That they may need support. I mean, that can happen when you have a child who is very, very ill and, might be very restless. We need to be much more understanding. I'm all for a reduction of institutionalized care. I've always fought for that. I think it's crucial, but then the community needs to be there. And I do feel that if we get this right, we're always going to have cases where things are not going to work, because that is how the world is. But we could reduce, difficulty for many, many people seriously.
Mark, I'll ask you about the event to finish off. But before we do that, for somebody who's struggling or who knows somebody who needs a bit of support, what would the Mental Welfare Society recommend?
I think right now the first port of call is 111. We always say, have you called 111? because they do have a structure that will sort of highlight areas, will be able to pinpoint. And although it has had a bit of criticism in the past, I mean, I also feel that sometimes it's because the places that they are then referred to may not act as quickly. So that is what I mean by then community support being there. I mean, the help might not be immediate. What can happen until that help is available? So 111 is key at the moment. Call 111, explain what it is. They're very, very patient, and then they'll see. If that doesn't work, or the result is not the one you want, then get in touch with us.
All right. And the Mental Welfare Society is marking World Mental Health Day on Wednesday with an event happening at the John Mackintosh Hall, starting at
6:30.
6:30. And do people need to register in advance?
No, they can just turn up. I mean, I think there's a limit of 50 people. I mean, I don't think we'll get, I think, to more than that. But I mean, I think it doesn't really matter how many people come, as long as they're key people who need to make the changes, attend.
Absolutely. Okay, so that's Wednesday, 6:30, you said, at the John Mackintosh Hall.
Yes.
Best of luck to the Mental Welfare Society with that event. Thank you, Mark Montovio, for joining us.